Before understanding thoracic outlet syndrome, we need to know what is thoracic outlet. So, thoracic outlet is a space between clavicle and first rib. Blood vessels, nerves and muscles that extend from back to the arm passes through this space. Thoracic outlet syndrome is a group of disorder that occurs when the blood vessels or nerves in the thoracic outlet become compressed. Main reason for getting thoracic outlet syndrome is compression of nerves and vessels in the thoracic outlet. The compression occurs for various reasons such as trauma like car accident, repetitive activities like job related or sports related, anatomical defect such as cervical rib. Cervical rib can narrow the space for blood vessel and nerves and eventually causing you thoracic outlet syndrome. Poor posture like rounded shoulder or kyphotic posture narrow the thoracic outlet and causing thoracic outlet syndrome. Pressure on the joints can occur from carrying backpack or being overweight, and that leads to thoracic outlet syndrome. Some hormone released in the pregnancy causes ligament around thoracic outlet relax and may causing you thoracic outlet syndrome. There are mainly two types of thoracic outlet syndrome. Number 1, vascular thoracic outlet syndrome, and number 2, neurological thoracic outlet syndrome. Vascular TOS occurs in 2% of the cases, and this include compression of blood vessels, while neurological thoracic outlet syndrome occurs in 90% of the cases, and this include compression of the nerves. Symptoms of the vascular thoracic outlet syndrome: pins and needles or numbness in the arm and hand, decrease or absent arterial pulse, swelling, coldness and color change in arm and hand. There may be a feeling of stiffness and heaviness, fatigue in the arm. Symptoms of neurological thoracic outlet syndrome: pins, needles and numbness in the finger, weakness of the arm and hand, loss of coordination in the hand, muscle spasm in arm and feeling of stiffness, pain at the wrist, at night pain. There may be less commonly dizziness, headache and vertigo can be occurs in neurological thoracic outlet syndrome. There are several factors that seems to increase the risk of thoracic outlet syndrome, such as female are 3 times more likely to be diagnosed with thoracic outlet syndrome than men. Thoracic outlet syndrome may occur at any age, but it is most commonly diagnosed in adults between the age of 20 and 50. Your doctor will first perform a physical exams and review your symptoms and medical history. And after that, to confirm the diagnosis, your doctor may order additional tests like X-ray, MRI or electromyography. X-ray may show presence of cervical rib and confirm the diagnosis. MRI shows the detailed image of thoracic outlet, and from that, it can shows any compression in thoracic outlet. Electromyography test allows your doctor to see how well the muscles and nerves in the thoracic outlet working. Treatment for thoracic outlet syndrome typically start with the use of medication to ease your symptoms. Over-the-counter medication such as naproxen or ibuprofen may be used to reduce inflammation and pain. In some cases, your doctor may give you thrombolytic drugs through your veins or arteries to dissolve blood clots in thoracic outlet. They might also prescribe anticoagulant drugs to prevent the blood clots. Physical therapy is also recommended to help with the controlling thoracic outlet syndrome. You may need surgery if your symptoms don't improve with medication or physical therapy. Surgery to treat thoracic outlet syndrome, called thoracic outlet decompression, that may be performed using several different approaches. These approaches involve removing a muscle and portion of first rib to relieve the compression, removing clot from the vein or artery, replacement of damaged artery with grafting, and removal of cervical rib. Your physiotherapist will perform following special tests to confirm the diagnosis. Number 1. Roost test. Patient should have to hold the both hands in surrender position and maintain this position for some time. The test is positive if there is a reproduction of the symptoms or arm collapse. Number 2. Modified Roost test or elevated arm stress test. Patient have to hold the both hand in surrender position same as in Roost test. Now patient will opening and closing the fist or both hand continuously. If patient is having TOS, the symptoms will provoke. Number 3. Edson test. The physiotherapist first palpate the radial pulse of the patient. Now ask the patient to take a deep breath and extend and turn the neck towards the affected side. Now again palpate the radial pulse. Decreased or changing in the radial pulse indicate the test is positive. Following are the main goals of physiotherapy management: pain control and decrease symptoms of thoracic outlet syndrome, facilitating return to work and improving function, posture correction, patient education, and overcome of the weakness. The treatment for thoracic outlet syndrome include following. In the stage 1, ice pack is applied at starting and ending of exercise. TENS, ultrasound or hydrocollateral pack is given to relieve the pain. Breathing technique such as diaphragmatic breathing will lessen the workload on the scalene muscles. Neural glide of affected nerve is helpful. Soft tissue manipulation to remove the structural limitation is done by the physiotherapist. Exercise in stage 2 include: Number 1. Postural correction. Postural correction is done by following the physiotherapy techniques such as myofascial release technique for scalene, pectoralis and scalene muscle stretching, scapular mobilization, and sternoclavicular joint mobilization. Number 2. Massage of the shoulder girdle. Deep kneading and patrissage followed by effleuras to improve the venous and lymphatic circulation. Number 3. Other exercise which is done in thoracic outlet syndrome are nerve flossing exercise, isometric neck exercise, shoulder exercise to restore the range of motion, which will provide more space to the neurovascular structure, range of motion exercise of cervical spine. Activation of the scalene muscles are the most important exercise because it can normalize the thoracic outlet function and malfunction of the first rib. It may not be possible to prevent thoracic outlet syndrome, but if the condition develops, you can take steps to reduce the symptoms and prevent it from reoccurring. This will include practicing good posture habits, maintain healthy weight. Patient should not carry heavy weight. Patient should avoid physical activities that result in rapid breathing. Practice relaxation exercise such as deep breathing, meditation, and stretching exercise. Avoid emotional stressful situations. While sitting, rest the affected side on the pillow. Avoid making repetitive movements. Follow this all the instruction of your physiotherapist to get better recovery from the thoracic outlet syndrome.